Pathlogic started out in 1999 as a renal biopsy service. I say that somewhat surprisingly because it is much different now. It's a multi-specialty, multi-dimensional laboratory that does every aspect of anatomic pathology. So in a short 10 years, we've come a long way. I really always wanted to dedicate my professional life to looking at renal biopsies, and that fortunately came true in 1999 when Pathlogic got started. And over the years, Pathlogic has grown tremendously, but that same level of dedication has remained. Now we have 3 renal pathologists, and the same is true. All 3 of those renal pathologists are dedicated to doing renal pathology and only renal pathology, and they're also very dedicated to supplying the best possible diagnoses for nephrologists. I think the fact that we have 3 dedicated renal pathologists in one laboratory, it allows us to work with each other, to show each other difficult cases, and to make sure that we have the right answer before we call our nephrologist or produce that final report. And so that kind of dedication doesn't come from a large national lab that is concentrating on the bottom line. It comes from a group of pathologists that are really serious about their profession and dedicated to providing nephrologists the truth and the best possible answers that they can provide them.
Our electron microscopy lab, with a staff of 3, has a combined 40 years of experience, of which I've had 25 years in lab management in both academic and private institutions. The emphasis of our lab has been to develop a process that results in an accurate diagnosis with the most efficient turnaround time. Our efforts are directed toward generating rapid results that the pathologist can be confident with 100% of the time without compromising accuracy for the sake of speed. In order to assure the highest quality result, it is essential that the biopsy tissue be shipped in vials that include the proper fixative Pathlogic provides. The tissue is accessioned and sent to the appropriate lab for processing. The IF tissue is now cut and stained with the proper antibodies, and the EM tissue is processed. The EM tissue is sectioned using a UC6 ultramicrotone, producing high-quality TEM specimens. The 208S EM scope, crucial for renal biopsy diagnosis, is an invaluable tool used to obtain detailed structural information at a high resolution necessary for accurate interpretation. These images, generated from the EM scope, are examples of the high-quality work provided by Pathlogic used by the pathologist to determine the diagnosis.
At Pathlogic, we are proud to combine our diagnostic expertise with technological innovation to assist nephrologists in achieving the best possible outcomes for their patients. We have invested in robust technologies to bring the nephrology community near instantaneous biopsy results with our online reporting system. In today's practice of medicine, technological innovation is vital in rapid delivery of diagnostic results. Nephrologists have 24-hour access to biopsy results by accessing our secure website. Upon inputting their individual login ID and password, nephrologists will choose to view reports for either their own patients or for those of their medical group. By clicking on the patient name, the full biopsy report is shown along with high-quality color images of the diagnostic findings. At Pathlogic, we now have the capability to do audio-visual reporting in addition to our written report.
Hello, Dr. Lim. This is Dr. Kolbeck from Pathlogic. We received the renal biopsy on your patient, Linda Lupus. I finished looking at the biopsy, and the final diagnosis is going to be membranous lupus nephritis. I wanted to go over some of the pathology. Here we have a low-power trichrome stain, which is good for looking at overall...
In the audiovisual report, you will hear the pathologist explain the pertinent pathologic findings as the cursor shows them to you on the slide image.
Feature of membranous nephropathy, whether primary or secondary. Of course, this patient has lupus.
Routine processing for renal biopsies is done in really 3 ways. One, moving the formalin-fixed tissue over for H&E stains, as well as trichrome stains, PAS stains, and a Jones silver stain. The second thing that happens with our kidney biopsies is that they are moved into our histotech department for cryostat sections and rapid IF. Then the third thing that happens is tissue that's submitted in glutaraldehyde will go for EM processing. Routine H&E and the immunofluorescence studies are done the same day. About 90% of the time, we can pick up the phone and call you and we've got a diagnosis. About 10% of the time, we need to rely on the ultrastructural studies to give us further insight. But usually how it works here is within 24 hours, we'll give you a call on preliminary diagnosis. The next day, the EM comes back, we'll sign out the case, and about 90% of our cases are signed out within 48 to 72 hours.
Today, nephrologists have a choice of where to send their renal biopsies. There are larger programs. There are programs that are dedicated to academic programs with doing a lot of research. I think that Pathlogic offers a unique platform for nephrologists in the sense that we have 3 academically trained renal pathologists dedicated to doing renal pathology and providing the highest level of innovation of service that is competitive with any program in the world.